Hi, everyone. I'm really excited to be here to talk about aging and how we can really make your programs more age-friendly, more age-positive. I loved that. I absolutely adored that. So I have to thank everybody who's spoken so far because you gave me so many ideas that's going to help me skip around and ignore the PowerPoint for a while. I'm so amazed by what you guys have been able to accomplish in your programs that it's just, bravo, seriously. So what's great about what they presented and what they talked about is you have two really different models that that benefited the people, the residents, in a very great way. But they also require some planning, some thinking, some money, and a lot of that forethought that takes time. But many of you are facing these challenges today. And tomorrow when you go to the office, you're going to want to do something because you're going to be so energized by this fabulous conference where hopefully you didn't spend the day making out. But hey, if you did, I support that as well. But you're going to be really energized and you're really going to want to do something. Whenever I go to a conference, I always want to walk into my office the next day with at least one idea that I can act on immediately. So, knock on wood, hopefully I'll be able to give you one of those. So a couple of themes that have been coming up, and then I'm going to kind of talk a little bit about some big picture stuff. Fear, uncertainty, health, and happiness in that interrelation. And these are all things that are really important. The unstructured time and engagement, also key. That community development, wellness, socialization, all of this stuff is really so key to helping older adults thrive. There's a definition, and you can Google this because I don't have it and I wish I did, but there's a definition of aging that is absolutely beautiful that talks about how older adults are people with a history, but they're also people with a future. And that's what frequently our culture misses out on. You know, with a very youth-focused culture, we forget that older adults still have a future. My mother's 70, and I know that she's going to be tormenting me for at least 30 more years. I'm fully prepared for that. And I love that because it's a beautiful thing to have older people in your life. And everyone, if you don't know an older person, like that you're close with, that you can chill with, have coffee with, find one. Adopt someone off the street. It's great. You really have to because you can just learn so much about aging. The other thing that came up so far today, and I'm going to talk more about this, many of you probably have young staff members, and you have young people working with older people. We have this in senior services. I know I look really young myself. It's not an issue. Old people and young people can work well together, and they can get each other. I loved the idea someone mentioned about training your staff members about what it's like to get older, because not only is that going to help them do their job better, but it's just going to help them live better. We're all going to get older one day, and we're all going to have older people in our lives. If you're not a caregiver right now, you're going to be one in the next 10, 20 years. So really, these are great things that you can do, and you can do them fairly easily. And now hopefully I'm going to give you some resources to do a lot of these things. I'm from Council of Senior Centers and Services. This is some of the stuff that we really work on. We do a lot of great advocacy. We bridge service silos, and we build coalitions. We want to work with people that we don't usually work with, and that's part of the reason why I'm here talking to you guys who may not be familiar with my agency. We do a lot of training and capacity building. I hope that raises some red flags for you guys because I just talked about training. If you want to train your staff on aging, give me a call. We have an innovative approach to programs. We don't do a lot of traditional direct service, but we do a lot of things that other folks can't do, don't have money for, don't have any sort of ideas. If there's a program that has to be done and there isn't a place for it, we generally adopt it. And we do a lot of research, and I'm going to talk about that as well. I want to help you connect with senior services in your community. If you don't know where there's a senior center near you or you don't think there is one, there probably is. There's 249 of them in this city. We can find you one. I want you to focus on health literacy and helping your clients identify their healthcare needs. There's actually a handout in the back that's called Good Questions to Consider. Read them over, give them to clients, talk to them about it. If they're going to medical appointments, they need to have lists of questions to ask people. And we're going to talk about how that health literacy, all of those wellness programs that you guys talked about, it's going to increase people's quality of life and help them really function at such a higher level, which is wonderful. And we can talk about how you can increase aging-focused programming. So hopefully, some of these things take time, but some of them you might be able to really work on immediately. Victoria already went over some of the statistics. Here's some more. You can kind of read them and absorb them if you can. But basically, we have these baby boomers who are aging. 10,000 people turn 65 every single day. That's a lot. And we also have increasingly diverse populations. It's not the same picture that we see when we envision a little old lady or an older man. We don't have a lot of those stereotypes. We have a very, very diverse population, and you see that every day in your programs. Health status is the biggest challenge. So 88% of people over 65 have at least one chronic health condition. David listed a bunch of them. Here's some other ones. You guys are familiar. Your folks are dealing with this. 48% have more than 3 chronic conditions, and these are Medicare participants. 20% have more than 5. That's a lot to deal with. And we know that about 1 in 5 older adults have a diagnosable mental and/or substance use disorder, and that's just diagnosable. How about those folks that don't quite fit that diagnosis criteria, but we know they have some issues with something? So comorbidity and the presence of multiple chronic health issues affects the progression of any other illness that they have going on, decreases quality of life. Anybody who has an older person in their life knows this. I just spent the last week in the hospital with some of my family members. They got multiple health conditions. They got lots of issues. They're going to complicated diagnoses and higher risk of disability, mortality, chronic hospitalization, and all of this. We also know that it's going to alter treatment regimens and so on. You guys are dealing with a very special population. They have higher needs than average Joe. Experiencing homelessness accelerates frailty. Your younger, older folks are going to have the health status of a much older, non-homeless person. You've seen that. We know that that's true. Homeless, formerly homeless older adults are also at higher risk for memory loss, dementia, and decreasing physical wellness. If they have any other issue, like mental illness, HIV, AIDS, especially substance abuse, all of that is going to make it even more difficult. Health literacy helps health outcomes. If folks can understand their illnesses, understand their treatments, and know what they can do about it, they can actually take control. And what's cool about health literacy is it's something that every single person in this audience can do something about tomorrow. You can start focusing on this with your clients. I know that many of you already do, but I'm just trying to bring this home. It's so important for an older adult, especially somebody with multiple health concerns. It's going to really help if you can empower them to ask those questions, to learn about their treatment, to know what the medications are for, so that they can really subscribe to those theories that they have to follow up on their medication regimens. I know it's not that easy. It's okay. I know I'm dreaming, but we can help. We can help. And the importance of nutrition. I know you guys mentioned nutrition and food. I mean, nutrition is medicine, and helping people to see that is really very important. So let me talk a little bit about some of the services that exist for seniors today. This is stuff that you can tap into. This is an opportunity for partnerships. And there's only so much that I can really describe in a really short period of time. So please, please come talk to me. Ask me questions. Let me see how I can connect you to people. So we have 2 types of senior centers here in New York City. We have innovative centers and neighborhood centers. The innovative centers, there's currently 10 of them, and they have specialized populations. We have the LGBT center with SAGE, and we have one for people who are visually impaired. If you have any folks that identify that way, send them to those centers. They can help with any of those special needs that they have. But we really have centers in almost every single neighborhood. Like I mentioned, there's 249 of them. What do they offer there? Meals, nutrition education, information and referral, recreational and educational opportunities, Social services, health and wellness, exercise classes, a lot of the stuff that David talked about he offers in his centers, they're in every other center. So if you're not near him, that's okay. They exist elsewhere too, although I highly recommend his centers. We also have transportation, home delivered meals, home care, caregiving. These are some services that are out there that are open to anyone, mostly for people who are dealing with low-income issues. If you're not sure, ask. One of the great things about aging services is that they're wonderful people and they're really friendly. So you can always ask questions. Think about how connections can be made and partnerships can be formed. We also know that folks who are homeless or formerly homeless are also at increased risk for victimization. And elder abuse becomes a really big concern, especially if they have other people that are involved in their lives. So we talk about those issues and we know how to handle them. Very important. And then there's senior employment services for low-income folks. Great options if folks can still do that kind of stuff. How to access these services? You can come ask me. I will help you find out who might be in your neighborhood. I might have some good recommendations. The New York City Department for the Aging has an awesome website. They have really good descriptions of all of the services that are around in New York City. They explain them well. They give you portals on how to access them, who to call. There's a zip code search for some of these services. So if you want to find out what senior centers are in your zip code, go there. I could give you a really ugly map with, dots of all 249 of them, but that would be useless. Go to the website, Google it, take 2 seconds. I promise it'll be easy. You can go to our website. We're in the middle of redesigning it, so it's kind of ugly right now, but you can go there because that can direct you to some of the folks that work in my office and some of the programs that we have and how we might be able to partner. Really great. Also, the State Office on the Aging, the New York statewide government agency, also has a good website with lots of information about benefits and resources. So really, I highly recommend what's on the web. It's all there. We don't need any additional information. Really, you can find it. And if you can't find it, you can call me. I'll help you find it. I'm pretty nice like that. So the last thing I'm going to touch on, and this is actually available in our senior center study, which is also available on our website. You can download it for free. So what do seniors want? Pretty much what we thought they wanted, but they really talked a lot about health and fitness and educational opportunities. They also really are excited about giving back, volunteering, feeling useful. That's something that's really important. If they realize that they can't work, my mom can't work right now. She's retired, but she's still passionate. She was a teacher. She has a lot of passion, and she wants to give back. So she loves volunteering. She loves, helping out in classrooms because she enjoys that, and that really makes her happy, and it helps keep up her cognitive capabilities. It helps get her out of the house. It helps that recreation and socialization, and it's even education. So not everyone can do that, but there are other opportunities. So this is what seniors told us they want. When we asked seniors at senior centers and seniors who didn't go to senior centers what they wanted to see, and this is what they wanted to see. So it gives you some idea. It's not rocket science. This is what everybody wants.